Hi, I'm Tara with Resplendent Hair, joined here today by Dr. Hanna. Thank you for joining us. Dr. Hanna, I would like to ask you if you could please tell us a little bit about yourself.
Yeah. Well, first of all, thank you very much for having me here, Tara. It's a pleasure to speak with you again. So, I'm a specialist in hair restoration and hair restoration surgery here at Resplendent Hair. Um, and in my off time, I actually spend it as a physician doing disability evaluations and helping those veterans that require assistance on our Saturdays when we're not operating.
I think that's great. Thank you for doing that. I think that's just wonderful. Today, I wanted to discuss with you if you could please explain to us non-surgical treatment options that we offer here at Resplendent Hair. Can you briefly explain what non-surgical restoration treatments are and how they compare to surgical options?
Yeah. So there's a variety of non-surgical options, everything from medications to injections. And um, in a brief overview, there's things called minoxidil, finasteride, dutasteride. These are the medications that may be taken orally or as sprays.
Mhm.
There are the injectables, which comprise of PRP, platelet-rich plasma, uh, exosomes, another type of injection, um, and stem cells, which are the most advanced, where you're removing some tissue and placing that into another part of the scalp.
Perfect. What are the main advantages of choosing non-surgical treatments over surgery for hair restoration?
Sure. With regard to hair restoration, the main advantages um, depend on a case-by-case basis and the stage of hair loss that patient's in. Um, Clear benefits are always that um, the medications have been established and used for decades to the point they minoxidil oral uh, tablets are pennies on the dollar, and are effective and are safe. Um, and beyond that, for those patients that don't have a great response to baseline medical therapy, the procedures like PRP, it uses your own blood. So, for example, unlike a blood transfusion, which has risk of infection, that's always a risk we talk about in the hospital. Um, nice thing about using PRP is it's your own blood into your own scalp. Um, and that goes the same for the exosomes and stem cells.
Great, thank you. What makes non-surgical treatments such as PRP and stem cell therapy effective for hair loss compared to traditional methods that we may have used?
Sure. So traditional methods, I'll go ahead and define those as the medications, and in the past, it included surgical options called the strip method,
Mhm.
as PRP and exosomes and stem cell therapy were in their infancy in science. Um, so you kind of had two options back then. You could try the medicine. If the medicine didn't work, you were stuck with um, cosmetically not really pleasing procedure, a risky-ish procedure to cut the scalp and suture it like that. Um, but with the advancements in science in the last decade, even now we have things that didn't exist before: PRP, exosome, stem cell therapy, at least with regard to hair, um, and they are, like I said, hugely advantageous in and of themselves, because of the lower risk associated, compared certainly with a strip method of surgery.
With these treatment methods, are they permanent or do patients need to expect some kind of maintenance?
Yeah, so that's a great question. I get a lot of time from patients. Um, and I like to joke that you only have to take your medication as long as you want to keep your hair, but it is true. Um, so, as far as those medicines go, typically they are indeed as long as you live or want to keep your hair. Um, and with things like PRP, platelet-rich plasma, sometimes patients have a wonderful response after several months of treatment, um, and then maintenance with medicine alone works fine, or maybe uh, a follow-up procedure with another PRP injection. With exosomes and stem cells, the hope is often that the stem cell will be a definitive solution,
Mm-hmm.
but always, for all of these, there's going to be maintenance with usually some kind of medicine or spray and follow-up visits.
So if I'm understanding this correctly, it's kind of like when you go to the dentist and you get your teeth cleaned, you need to brush them at home in order to maintain the results. Is that how you would
Yeah, that's a
say that?
you hit the nail on the head with that one.
Perfect. Um, so with that being said, let's dive into PRP therapies.
Okay.
So Dr. Hanna, can you tell me how PRP works and what the patient can expect from the treatment?
Yeah, of course. So PRP is a new scientific breakthrough. Really, it's been occurring over the past decade or two. But as far as it pertains to hair restoration and regeneration, in layman's terms, you're taking the patient's very own blood, um, spinning down or centrifuging it to separate the different parts. So the red blood cells and white blood cells and all of those other parts are spun away, and we keep the platelets, these very small cells, and the um, factors associated with them, which are much like um, giving fertilizer to a growing tree, useful in promoting and maintaining blood vessel growth, and turning those small, thin, villus hairs, these baby-like hairs that are a little weak, like a sapling,
Mhm.
into strong oak trees or lush hair, if you will.
How do you manage to mitigate patients and potential risks with PRP?
So one of the great things about PRP and what makes it a valuable breakthrough for our patients is that we are using the patient's own blood. So,
Mhm.
unlike conducting a transfusion in the hospital where you're using donor blood, which is screened and uh, unfortunately, as with any procedure or um, uh, invasive um, delivery of blood,
Mhm.
will carry a risk of infection.
Mhm.
However, not if you're using the patient's own blood and returning the portions to their own scalp. Um, there will be certainly no risk of transmitting a disease from a patient to themselves or even causing some kind of allergic reaction, for example.
Okay, so because we're using a patient's own blood, the body is more recipient
Yeah,
to the
it's the
treatment. Is
perfect
that,
recipient.
yeah.
Yeah, of course.
So, yeah. So, I mean, it ends up being, I guess, if you will, using your own body to heal itself
That's a
in a
great
way.
way to put it. That's
Okay,
exactly what it is. And
great, great. Um, Moving on to stem cells, Dr. Hanna, can you tell me what role does stem cells play in hair rejuvenation? And how do they differ from treatments such as PRP?
so stem cells are now the latest breakthrough, if you will, again, as it pertains to hair restoration. Um, and it's similar to PRP in the sense that we are taking something.
Mm-hmm.
In the case of PRP, we talked about the platelets from the blood. And in the stem cells, we're talking about these um, younger cells that are not fully matured from usually the nape of the neck,
Mm-hmm.
and transplanting those into the areas of the scalp which are balding. Now, it does go on a case-by-case basis, and it does matter which norwood stage or which degree of hair loss has occurred as to which treatment is best for each patient.
Mm-hmm.
For those patients who have advanced hair loss and have already conducted PRP to promote as much growth and lush hair as they can and have maxed out on benefits, those are typically the patients that we start to proceed to exosome stem cells and hope to uh, give them the full head of hair that.
So, if I'm understanding correctly, Dr. Hanna, stem cells are taken from the nape of the neck. So, again, you're using your own body to help grow new hair, strengthen hair. Are we actually generating new hair growth with stem cells?
Perfect question to clarify on there. So, in areas where you just do not have hair, you're able to take these cells, move them to that area,
Mm-hmm.
and both promote. Hope the idea is that we're hoping to promote the division of these um, not fully matured cells into the mature type, which once transplanted in the right region should be the strong hair type, as opposed to the nape of neck type.
Got it.
Yeah.
Now, I've read that you can harvest stem cells from fat and
Mm.
bone. Why are we not using those methods versus the punch biopsy that we're using for our stem cells?
Yeah, so this actually goes all the way back to what are stem cells and how do we derive them, and maybe there's still some controversy about how are stem cells obtained, and this is quite a different story from what most people associate with stem cells, which are either placenta or so forth. In this case, progenitor cell would be a more accurate term, but for the layman, stem cell uh, is um, you know taken from exactly, you're right, the same tissue that the patient has, and again has no risk of causing like a rejection reaction.
Mm-hmm.
Um, and beyond that, the second part of your question, if you could clarify that.
Sure. So, why do we choose to take stem cells
Okay.
from this area versus bone or fat?
Yeah. So to answer that question, it's a pretty simple matter of the types of cells, progenitor cells,
Mm-hmm.
that are in closest to your hair and actually do have little bits of hair are more likely to develop into that mature type of head hair. If we take from fat or bone, not only are there obvious, or at least if they're not obvious, significant risks to taking a biopsy from a bone. That's quite
Mm-hmm.
an invasive procedure and a painful one. Um, Doing a punch biopsy, which is very superficial outpatient procedure and um, well tolerated as termed. I can't say pain free, but compared to a bone biopsy, pain free, um, it's safer and more comfortable for our patients.
Got it. Got it. Thank you, Dr. Hanna. So, Dr. Hanna, let's move on to exosome therapy. What exactly are exosomes, and where are they gaining popularity in the hair rejuvenation, hair restoration industry?
Sure. So, um, exosome therapy sort of fills this gap in between PRP, platelet-rich plasma, and stem cell therapy. And for in the past, um, going for, like we talked about, a bone biopsy or fat tissue contains notable risks and
Mm-hmm.
and of course is painful for the patient. So exosomes gained popularity because they are a injectable, and unlike modern techniques which we practice, which are punch biopsy and may now popularize and make stem cell therapy more accessible, these sort of exosomes, which are vesicles or little sacs containing um, factors that promote and stimulate things like angiogenesis or blood vessel growth,
Mm-hmm.
basically the development of healthy tissue, again, that fertilizer for the saplings that we want to grow into oak trees, and are derived from something called mesenchymal stem cells. And that's just a fancy way of saying um, certain types of cells that are known to promote um, healthy rejuvenation and are specialized for that process. And that's why we take these vesicles, the exosomes containing those factors from from what we call MSC,
Mm-hmm.
and use them to hopefully replenish the hair in those who are not responding well to PRP, and for whom either on a case by case basis or not yet a surgical candidate, or for some reason or the other um, wants to try something in that gap before a more invasive procedure.
I understand. Um, how do exosomes help stimulate hair growth differently than PRP or stem cell?
Mm-hmm. So exosomes are coming from a different cell type, and PRP is coming just from blood.
Okay.
So PRP will have the platelets and some other factors, but it will not have the constituents in MSC, mesenchymal stem cells, that um, are growth factors promoting, um, again, angiogenesis or blood vessel growth, um, to irrigate, if you will,
Mm-hmm.
the soil for the hair or the trees. And then stem cells, which are pluripotent, again, these are just fancy medical
Mm-hmm.
terms, um, really progenitor stem cells versus mesenchymal stem cells. Now we're kind of getting into the weed of things. Um, but they are different in the sense that we are hoping the um, pluripotent, meaning the type of stem cells that we're moving from one area to another, are most similar in composition and more likely to develop into the final adult cell of a hair follicle, whereas the mesenchymal stem cells that we are utilizing as the base for gaining exosomes um, come from a different source. So you will not have to have, for example, even a punch biopsy. This is something like in a solution that we
Mm-hmm.
provide to the patient. Um, and those patients that don't like needles and blood draws or biopsies, which my experience has been all of them, can settle for just an injectable solution. Yeah.
Okay, so if I'm understanding correctly, PRP has different components than the exosomes,
Mm-hmm.
and then the exosomes are the bridge between PRP and stem cells, but stem cells carry everything that you need.
Exactly.
Is that fair to say?
Yes, exactly.
Got it. Got it. You know, when it gets into these medical terms, sometimes it gets a little complicated. So I appreciate you making it easy to understand.
Yeah. That's the truth about medicine. If you
Mm-hmm.
can't explain to a patient at their level of understanding what or why you're doing, you don't understand it well enough.
So, Dr. Hanna, can you tell us what mesotherapy is and how we use that in hair rejuvenation?
Sure. So mesotherapy comes from meso, which is French for medium, and of course therapy we know is um, basically treatment. Um, in layman's and the way we use it in the hair restoration industry, we're really talking about microneedling.
Okay.
So it's a delivery system to provide things like enzymes, vitamins, amino acids, all these promoting growth factors into the area of the scalp.
Okay. And do you typically combine mesotherapy with other modalities or treatments?
Certainly can be combined. And if, for example, medical therapy is working well for a patient and they need the addition of um, mesotherapy, those would be a harmonious blend right there.
Okay. And then I also heard sometimes we utilize laser therapy with mesotherapy. Is
Mm-hmm.
that correct? Can you tell us what laser therapy is?
Yeah. Um, so laser therapy has come around. Certainly, everyone's familiar with laser hair removal, but we're talking about something different. We're talking about stimulating, again, uh, the tissue to grow, be healthy, and mature. So exosome, again, the microneedling, can be used in conjunction with laser therapy. Um, and the idea is they are synergistic in how they complement each other and will further boost the hair rejuvenation.
How is a patient to decide with all of
Mm.
these options which one to choose?
Well, the answer is pretty simple there. You have to talk to a doctor and come in for a consultation, um, or go to medical school.
That makes sense. So, if you're interested in learning anything further in regards to these non surgical treatment options, we encourage you to schedule a consultation with Resplendent Hair today. Thank you for your time, Dr. Hanna.
Thank you very much.